This paper was hands down by far the toughest of the 3 papers that I wrote out of my dissertation. And I have to really just express my gratitude to my committee for really encouraging me to do a paper-based dissertation. It's a lot harder at the outset to look at your data kind of broadly and think about how are 3 angles I can take on talking about this, overarching focus on looking at health management or health practices. But it was the toughest paper because it's the one that I decided to really focus on these big, like conceptual, kind of contextual pieces, and figuring out how to understand how those pieces are influencing how people think about health and how they go about their health practices. But those pieces are so interconnected and they're happening over a long period of time. So, this isn't just like a snapshot or like an acute sort of issue somebody's working through. This is like for potentially 30 years of experiencing discrimination. And then you have this infection that comes and it's making people in your community really, really sick. There isn't a whole lot of support for that. There's discrimination associated with your identity that's now layered into an infection that's discriminated, there's stigma there. There's so much happening. And so I wrote draft after draft after draft. And I remember my committee saying to me, my committee members saying to me, you know what, like Ingrid, there is something really important and valuable in this process of draft to draft, that you'll begin to see that there's things will crystallize. And it was so true that as I wrote from draft to draft, I began to see those connections. I began to better understand through that process of writing it again and again and again, and diagramming and moving pieces around and just trying to figure out. But that process of writing draft to draft, there is something I always say magical that happens conceptually, where things just start to see those connections. And although it does feel really frustrating at the time, I think I had about 12 drafts of this paper by the time that it was all said and done, where I felt really confident that I could speak to it with a level of, that I was really comfortable, that there was meaning there, and my advisory was really happy with what I'd come up with. So it took a while, but I think that's what happens when you have you have complexity. And I think our lives as humans, like when we do qualitative research, it's messy. There's so much happening. So definitely was a real challenge for me to write it for the dissertation. And then writing it for the publication was actually much smoother because I had the framework for the paper. I had to do some modifications for the journal expectations. Every journal has their requirements. But I did get, because it's a sociological publication, I did get some feedback from the reviewers. They wanted a little bit more theoretical input for some of the things that I was discussing, some of the content, so that was really valuable to have that opportunity to go back, look at some literature that had been recommended to me and say, hey, I would like you to speak a little bit more to this. Can you be a little bit more explicit about what you mean? So that was a really valuable exercise and was the most challenging piece of writing it for the publication. But the publication part was actually really nice and smooth. It was writing it for the dissertation that was a real challenge. But I was so happy when it was all kind of said and done and I had completed it.